Good evening once again. Thank you for joining the meeting, and we will begin right about now. And as I said before, my name is Diana Megan. I serve as the content coordinator here at Your Pharmacist Diary, which is the organization that is hosting this platform. And with me this evening, I'm joined by a wonderful group of panelists. Two of them will be talking about the pharmacy practice in the UK, and that is Dr. Sandra Kidula and Dr. Grace Mwarage. Then we have Dr. Karl, who will be talking about Australia, and finally Dr. Gladys Kingori, who will be telling us about how to go about pharmacy practice in Botswana. So without further ado, I will begin by introducing our speakers, and I will start with Dr. Sandra Kidula, who is a postgraduate student in the Overseas Pharmacist Assessment Program, University of Brighton. She has served as a superintendent pharmacist and pharmacy team leader at Nairobi Hospital Galleria Outpatient Center for the last 7 years, and she holds a BPharm degree from the University of Nairobi. Up next, we have Dr. Karl Alex, who will be talking about pharmacy practice in Australia. He is an MSc student, oncology pharmacy from La Trobe University Hospital. He is a member of the Royal Pharmaceutical Society of Australia. He holds an MBA from the Royal Melbourne Institute of Technology, and also holds a BPharm degree from Kenyatta University. Then we have Dr. Grace Mwarage, who will be talking about the pharmacy practice in the UK. Her clinical pharmacy experience includes the hospital pharmacy practice at Cheltenham General Hospital, GP practice at Barclays Place Surgery, community pharmacy practice at James Pharmacy. She holds a postgraduate diploma from the Overseas Pharmacies Assessment Program, Aston University, and she also holds a BPharm from the University of Nairobi. Finally, Dr. Gladys Kingori, who will be talking about the pharmacy practice in Botswana, holds a certificate in supply and procurement in progress at from the GUC, Gaborone. She's a licensed and general pharmacist in Botswana, former business development, that is sales manager at Lab and Allied, and she also holds a BPharm degree from Kenyatta University. So that is it. That's just a brief introduction about our speakers today, and they shall be able to tell us more in just a few. And I would like to give a chance to Dr. Sandra and Dr. Karl to just say hi to us even as we start. Yes, and we shall begin with Dr. Sandra. Please go ahead.
Hello, everyone. I'm delighted to be here today. Thank you, Diana, for the introduction. I was telling my friends that I feel like an engaged person being asked to do a marriage seminar because I'm just about to start my OSPAP course. But I am excited to be doing this session with Grace. Grace is a very good friend of mine. Both went to Alliance. Let me just throw that there. And then he went to the University of Nairobi. So I'm delighted to be doing this session with her. So I'll be focusing more on the pre-OSPAP process, and then she will focus on the bit about now practicing. So yeah, looking forward to interacting and answering any questions you might have.
All right, thank you, Dr. Sandra. We shall proceed to you, Dr. Karl.
Thank you, Diana. Hello, everyone. My name is Karl Mogaka. It's a privilege actually to speak to you this evening, morning, depending on where you are. I look forward to an interactive session. I hope that we both get to learn something. I'm happy to see there's a lot of colleagues that have signed in, and it's a nice time to also get to catch up as well. So thank you as well for the honor. Looking forward to it. Thank you.
All right. Thank you, Dr. Karl, for that introduction. Yes, indeed, so many people have signed up and attended joined this meeting. It just shows you how curious people are to learn about this. So without keeping them waiting, we shall dive right in. And we shall begin with the questions concerning the process. I believe for you, Dr. Sandra, the process is quite fresh, and we would like to know what is the registration process, what are the requirements, and if there are any additional studies that are required.
So thank you for the question. The registration process for the UK, I think it's actually quite lengthy compared to the other countries, and more expensive compared to the other countries. So there are three major processes. So the first thing is that you're required to do an overseas pharmacist assessment program. That's the course that we've been talking about, and the one that you can either do a postgraduate diploma or you can do an MSc course. There's no added advantage of doing an MSc course. So I'd suggest you do the postgraduate diploma. It's cheaper, it takes a shorter time. So that's the OSPAP course. Then after the OSPAP course, you're supposed to do 52 weeks of pre-registration training. That's comparative to the internship that we do here in Kenya, the Ministry of Health internship. So you finish your 9 months of OSPAP course, and then you do 52 weeks of registration training, which is paid. So let me just put that there. Then after that, you do a registration exam. Then you're eligible to become now a pharmacist in the UK. So the hardest bit would be the first part of starting to do the OSPAP course. It's a very competitive course. Many people apply from all over the world, especially India and Pakistan and Nigeria. And the places are quite limited. There are only 4 schools that offer the course. So before you apply to do the OSPAP course in the universities, you have to start by applying to the PPB of the UK, which is called the General Pharmaceutical Council. So they go through your details so that they confirm you can actually study the course. So that's actually, I think, for me, the hardest part of the process, because there are several documents that they need. Maybe I was telling the organizers that maybe we should have a different session just to discuss every single document that they need. So once you send those documents, then they send you the letter to show that you can do the course. Then now you can apply to the university. So there are only 4 schools that offer the OSPAP course in the UK at the moment. So there's Aston University, which Grace attended. There's University of Brighton, which I'm going to attend. And then there's University of Sunderland and Hertfordshire University. So you can only apply to the 4 schools. The advice is to apply to all of them. Since it's competitive, you pick the one that you get. So once you do the OSPAP course, then you apply for the pre-registration training before you start the OSPAP course. So you're placed for your registration training place before you begin the OSPAP course. So by the time you're starting your course, you already know where you're going to do your internship. Yes, so that's, I don't know whether there are any questions with regards to the requirements, because it's quite a lengthy process for the registration.
All right, thank you for that explanation, that very elaborate explanation, Dr. Sandra. And just to put it out there, in case you have any questions concerning this session, or any questions for the panelists, kindly feel free to use the Q&A section of this webinar to just note down your question. And once we are done with this set of questions, we shall get right to your questions, and hopefully they'll be able to answer satisfactorily. And also, another thing that's worth mentioning is that we will have a separate webinar just to discuss the process of registering and getting to practice in the UK and in the US. So you can keep an eye out for that. And yes, that's just a heads up. Also, we can now proceed on to Dr. Karl, whereby Dr. Karl will tell us about the registration process in Australia He'll tell us more about the requirements and if there are any additional studies required. Perhaps Dr. Karl could also tell us how long you have been practicing how long you have been in Australia as well.
Thank you, Diana. Thank you, Sandra, as well, for such a nice you've taken us through the UK. It's lovely to see that many of us are actually doing strides across the globe. And it's actually nice that even from the attendance, it seems like many of us really wants to practice abroad, which is nice. I mean, I'm encouraged. It's nice that you should join us. I mean, it's really cold out here being alone, and it's nice that you guys can join us and just to add the warmth. You know? So quickly on to Australia. I think it's a pretty straightforward process, but it's lengthy. So planning yourself ahead of time is what is important. So first things first, there's an exam that is called CAPS. So that is the first thing for you to do. CAPS is a knowledge of assessment for pharmaceutical advances in full. Before you do that exam, you need to submit your documents, that your pharmacy degree, your registration certificate, your passport, I think those three. And if you have any job experience, you can also submit. So the first step is to submit your documentation, then the Pharmacy Council of Australia will be able to evaluate them and actually see that you're fit to practice in Australia. If they give you a go-ahead, meaning that they've seen that your paperwork is okay, maybe you're qualified, then they'll allow you to now sit for that exam, CAPS exam. So those two processes that I mentioned take around 6 to 8 weeks to complete. From the time you submit your documents to the time they reply, it's around 6 to 8 weeks. So once they give you the go-ahead, then you can register to do the exam. The exams are done about 3 times in a year. It should be, there's one in March, there's one in July, there's one in November, if they haven't changed the last time we did. So you can choose from any of those 3. There's a center in Kenya. There's a center in Kenya offering the CAPS. So it's very nice for you. Some countries, I think Kenya is among the few countries in Africa that have a center for the CAPS. Otherwise, we'll have had to travel maybe to places like South Africa to do it. So once you do the exam, you wait around, I think, a month. Your results are through. Then you can use that result to look for employers. Yeah, you can say that you're now, the Australian Pharmacy Board has acknowledged that you're actually able to practice in Australia. And then now you need to scout around for employers. You can do it from overseas. Once you get an employer, they can either nominate you for a visa, or you can do it independently through what we call state visa nomination. A state can nominate you. A state maybe can say we need a pharmacist. So if you apply to be nominated as a pharmacist, then you can be nominated to apply for a visa. Yes, so then you apply for a visa. It takes another 3-4 months, right? Then you can fly and start working. So that is from home to Australia. So once you get to Australia, you don't start practicing straight ahead. You just get what we call provisional registration, which is 1 year. So you have 1 year to practice as an intern. Then there are things that you need to meet. You need to meet a minimum hours of 2,000. You need to clock 2,000 hours of practice. You also need to go through an internship training program, which I'll talk about a little bit later on. And also a few other things that you need to do. After you finish, then you can apply for formal registration as a pharmacist, then now you can start practicing, right? So you look at other whole process, you can give and take 2 years or so, and then you'll be a fully registered pharmacist in Australia. I think in a nutshell, that's pretty much it.
All right, thank you so much for that very elaborate response. The questions are coming in. We shall attend to them as soon as we're done, because some of them will be answered as we proceed with the session. I'd like us to, one thing that is common about what both you and Dr. Sandra have mentioned is just how lengthy and how some might say gruesome the process is. And I was wondering, or people here are wondering, if there are agencies that assist with the process. Dr. Karl?
Yes, thank you, Diana. Yes, they're agents, but I don't think, personally, if you ask me, it makes a difference, because this is a matter of just all your paperwork being clear. It's a laid out procedure. They'll pretty much do what you can also do. Maybe the bit they can help is getting the stress out of your mind. What do I need to do? What comes next? What comes after what? Because they already know the procedure, right? So if that is what it can save you, fine. Then you can pay the money, which is an arm and a leg. You can sit pretty and wait to board your ticket, But if you're a proactive person, you can always get information if you want to. You can get it. Then you can work it out. But what is clear is that using an agent does not necessarily shorten the timelines. It does not at all. They're just applying like you, only that perhaps they have the knowledge, so they know what to do after what. So it might be a bit faster for them, but not really much of a difference. Thank you.
All right, thank you. How about you, Dr. Sandra? At any one point, did you consider involving agents or using an agency to make the process easier? And if yes, or if no, what are some of the advantages or disadvantages? Perhaps it's different in the UK.
So for the UK, there's really no agency for the OSPAR process. So I feel it's more important to be liaising with someone who has gone through the process, because they'll be able to give you better guidance compared to going through an agent. So, for example, for myself, I worked with Grace throughout this process, because she has gone through the process, so she knows the pitfalls and what are the blind spots. So it's better to work with someone who has gone through the process. However, when it comes to applying to the schools, because you have to apply to the schools immediately the applications open, I found it easier to work with UNICEF. I used UNICEF throughout my school application process, because they're able to guide you as per the requirements, and also help you as you're applying for your visa as well. And it's completely free of charge. So I found working with UNICEF throughout the school application process can actually reduce the stress that you have to go through during that stage. But the stages before that, it's better to work with a mentor, someone who has done the process before, because it's easy to give up. So yeah, working with someone who has gone through the process.
All right, thank you. Someone else was wondering if there is a cutoff age for this entire process. Like, is there a cutoff age for the process? Like, beyond this year, you cannot apply? Both of you will answer. Perhaps we could start with Dr. Sandra.
There's no cutoff age unless you've retired. So if as long as you have about 6 months of experience, you can always start the process. There's no cutoff age.
All right. Dr. Karl, is it the same for Australia?
I'll say not really. Depending on the route you choose. Earlier on, I mentioned that there's two. One is either you get an employer to nominate you for a visa, and two is a state nominating you for a visa if a state feels that they have a skilled shortage of your skill, in this case, a pharmacist. So for an employer, maybe if they feel you're so experienced, I don't think they'll really mind your age. But for the state, they have a cutoff of 45 years.
All right, thank you. Thank you so much. In case you're wondering, the two remaining speakers will join us in just a while. Just be patient, you'll get to hear from them soon, I promise. But in the meantime, we could continue with Dr. Sandra and Dr. Karl. Then as soon as Dr. Gladys joins us, she'll be able to tell us about the whole process of registering and practicing in Botswana. Dr. Sandra, someone is asking whether one can begin the transition or registration process before completing the internship and getting licensed by the Pharmacy and Poisons Board of Kenya. Is it possible to start the entire process while you're still in internship or before you get registered?
You have to do the internship and you have to get licensed, because that's part of the documentation that you need to present, and you need to give your registration number for PPB as you're applying to the General Pharmaceutical Council. So the good thing is that internship is considered as part of work experience. So in the 6 months work experience that I'm talking about, you can actually just stay to your internship period. So yes, you have to register with the PPB.
All right, thank you. The next question is directed to Dr. Karl. Could you kindly share tips on how to study and pass the Australian CAPS exam?
Oh, thank you, Diana. Yes, share tips. It's a tricky question, yeah. So, I mean, it's an exam like any other exam. The good thing is the website of the where you register for the exam provides sample papers. So the exam is in two sections. There's paper one and there's paper two. So it gives both samples for both sections. The other thing is that you could try to get past papers as well from previous exams. I mentioned that there are 3 sessions in a year, so if you could just look at maybe from 2021 to 2024, now those are about what, 6 or 8 past papers, and some of those questions are actually repeated. So that is one. Look at the samples on the website. Then 2, look at past papers from previous years. It can give you a general idea on the areas that are set. There's also a recommendation to use the comprehensive pharmacy review book. That is, I think, what they use to set their questions. It's called CPR. If you can get the latest copy, the better for you. Yeah, and also Lipin Code Pharmacology. That's right. I'm trying to remember. I mean, it's been a while. So those two, comprehensive pharmacy review and Lipin Code Pharmacology, and then the past papers, as I mentioned. I think that's the best I can. If those are tips, really. I don't know. Diana, back to you.
I'm sorry about that. I'm sorry about that. Sorry I got logged off for a while, but now I'm back. We can proceed. Thank you. I was kicked out of the meeting when you had just finished giving tips on how to study and pass for the CAPS. So I believe we can move on to someone is asking whether it's possible to work and study at the same time. Dr. Karl, perhaps you could respond to this. Is it possible to work and study at the same time?
I think it's possible. You don't have to take leave or something of the sort to study. I mean, it's not really a hard exam, but also depending on the last time you studied, if it's been long enough, 5 years or more, I mean, it will be wise also to just take some time and study. But if you're fresh from campus, I mean, you can balance. You can put aside maybe 2 hours in the evening or 3. You do that for 2, 3 months, you're good to go.
All right, thank you. Dr. Sandra, what challenges did you experience while transitioning and how did you counter them?
Maybe I'll talk about the entire process. So, of course, the major challenge is finances. It's quite pricey, and I know we'll talk about that later. And just feeling like it can be so stressful that you would want to stop in the middle, especially when you're applying to the schools. And the other challenge is that the schools are quite competitive. So you start getting rejects and there are only 4 schools. So if you get the first school doesn't accept you, the second school, the third school, and it can be quite stressful. So I think getting that moral support, as much as you need financial support, getting that moral support is actually quite important. So I'd say financial challenges and just moral support, that willingness to continue when you feel like you would want to give up. Yeah, I think those are the major challenges. Applying to the schools, it's quite competitive and you have to be the first to apply. Literally the first 10 minutes that applications open, if you miss out on that window, you may not get a chance to do the course. And you've already invested in applying to the GPHC because it's about £700 to apply to the GPHC.
All right, so you have to be quite swift and ready to go and grab your chance. All right,
Exactly.
so, all right, thank you so much. Dr. Gladys is here with us. Perhaps, Dr. Gladys, you could unmute and say hi to the audience and tell us about your experience so far, how the move has been, and for how long you have been in Botswana.
Hello, everyone. I hope you can hear me. You can hear me?
Yes, you can.
Our network here on this side, it can be a little bit slow. So you tell me when it's slow. So I've been here in Botswana. Let me say I started the process around last year, May, just after my board exam. So I applied and I came here in Botswana just as a vacation. So I met a few pharmacists who have been here for a long time, say 25 years and more. So those are the people who really encouraged me to to apply and come here to Botswana. So let's say I've been in and out of Botswana since May last year up to now. Yeah. So far I can just say I am a registered and licensed pharmacist. So I don't know how we'll go about it. What am I supposed to say?
You're doing well so far. And maybe you can tell us about the registration process, the requirements, and if there are any additional studies required. And also, on that note, you could also tell us how long the process took and how much did it cost.
So let me talk
Yes.
about the requirements. I had sent something. I don't know if you can share that. It would be
Yes, yes,
easier.
yes. All
Maybe you
right.
can share that.
Someone will be sharing it in a while.
Okay, as we wait, generally you have to have all your documents certified. And here we are still in Africa. So maybe Majuri, you do PDF. Here we do the stamped copy. So like they have to see almost the signature that has verified your documents. So you verify your certificate. That is your degree certificate and your transcripts. Also, you have to be registered in Kenya so that you can start the application. So you can't do like you're a student, you start now. No, you have to go through the whole internship program, and you have to be registered in Kenya. So you have to give the license that's also verified or certified, and then you have to have your license and your registration certificates have to be stamped, and those copies are you applied to the council as hard copies. Even the internship where you've gone for your internship, you have to have those letters. I know we submit them and forget about them. You have to have them. They have also to have the stamps that you indeed went to those places for your internship. So it's a tedious process, but it's worth it once you're registered and you have a permit, and now you can practice. So I'm hoping they have shared, have they? Maybe let me just go on. So I've talked about the certificate. You have also to get your passport verified. You have to have, aside from the internship part of your CV. So I got lucky because they were going to cap the experience years to 3 years. So I got lucky. So they had not decided. So I don't know moving forward if they'll be allowing people who have less experience than 3 years to apply. But you can try your luck. As for me, they didn't really require a lot of experience from my side. So they had a meeting. I don't know how far that is. Maybe once you reach out, I'm always available on WhatsApp. If you reach out, maybe we can see and ask them if they have the cap for 3 years. So you have to have your CV with 3 references and your original certificate of good standing. So this one you have to get from the PPP. So you have to apply and pay. Is it 1,000 shillings? Yeah. You apply, then they write a letter and they seal it. So you have to deliver it. Either you come to Botswana or you can use the G4S or any other courier services. Um, Yeah, you have to have IELTS if you are coming from yeah, that is. So we've already talked about your passport has to be certified. That is you can go to the immigration offices, that is near your house, or whichever one they are now devolved. So you can go to whichever immigration office to get it certified for you. The passports, we've talked about anything that you've changed in your name or in your certificates, you have to have certified evidence. And then certified copies of your qualification. That is, if you have any extra qualifications apart from the B Farm, you have to have certified copies of the same. The internship part, I talked about it. Application letter, yeah, you have to write a letter Doesn't have to be handwritten. It can, you can type. Sometimes they ask for handwritten, but this time they just allow for the PDF version. Application, yeah, you pay 300, and this 300 you pay for the license. You don't pay anything for the examination and for them to look at your documents. So this 30 pula, that is 300 shillings, you pay after you're done with the whole process. Yeah. Your practicing license and your registration. Remember, there are two. One you download from the portal and you have it certified. The other one you'll receive from PPB and you have to have a certified copy so that you can remain with your original documentation. Original good standing, it has to come from PPB. I had talked about that. Professional references, they have to write recommendations for you, so you can be having that. And then the English part, if you're not coming from an English speaking, of which we are all, so here IELTS are not really necessary unless you're coming maybe from outside. So let me say the process takes around it depends on your speed of application. It can take 3 months. It can take, for me, it took 8 months for me to sit for my exams, which I did this year around March. So I'm fairly very new, but at least now I have a fresh memory of what I've been through to get all these documents that are being displayed. And yeah, I think you do one exam, which is one of the easiest pharmaceutical examination I've ever sat for, because it's more of the practical aspect. Like, how would you console a patient? Yeah, it's very easy. So you have to score a 70%. And we have 3 markers, 3 examiners, which they will go through your script. So yeah, you have to satisfy the board. After that, you are called for a spoken exam. You call it oral exam, yes. And then also you should score 70%, which is not hard. Maybe 2 questions. Yeah. If you've done your stage 1 and stage 2, you'll definitely pass this Botswana exam. But now the process can be draining, emotionally draining. You have to be prepared. I was not prepared. I thought it was, since it's Africa, it's easy. You'll just submit, get examine, do your oral, and you're done. It took me 8 months, and they have been the true test of whether I love pharmacy. And yeah, for now I can say I still love pharmacy. So back to you, Diana.
All right. Thank you. Thank you very much for the entire process. So in case you would like a copy of that document, feel free to reach out either on WhatsApp or via email. We will share the WhatsApp contact here in the chat section and also the email. So feel free to email YPD for the document that contains all those requirements to go and practice in Botswana. Yes, thank you very much, Dr. Gladys. That was very fantastic. And we would like to know if you experienced any challenges while transitioning and how did you go about those challenges?
My challenges. Well, let me just start by that statement because it was not easy. First of all, my application, I was among the first 10 to be the cutoff for the November exam. So that is, I can equate that to a rejection letter. You know how you feel, eh? So yeah, it was sad because I was very excited. And then it's Africa. So you think like you're entitled to get accepted. So yeah, that was my first challenge. Another challenge was I couldn't understand, like, if you get your verified copies, why do you need them stamped again? But here in Botswana, it's like now you're going back in Kenya, like in the 90s. So everything has to be you have to see the hard copy, the hard evidence, because unfortunately we all know about the fraud that has been there. So they're trying to minimize that. And then our population is so low, so they really want to get the best. So another challenge, of course, is the finances. It was crazy because I had to fly to Botswana, then Kenya, then Botswana again. So the finances were equally draining, and also let me say the number of days you are allowed. We have an agreement with Botswana, so you can get 90 days free to come and stay in Botswana, whether you are a tourist or whatever you're doing. 90 days, you are guaranteed. So with me, I had to come back and get back the 90 days, if that makes sense. So it's 90 days, not a calendar year. It's from the day you entered. So you have to calculate. Like I normally tell my friends who say they want to come to Botswana, I say you have to calculate. Like you come here, you apply one day, then you're out. Because you can travel by air or by bus, luckily. So the buses are cheaper. You can go through Zambia. You know, you are traveling Africa, the whole Africa, TZ, Zambia, Namibia. So it's quite cheaper than the airfare, which goes for around one way can go up to 80,000. So if you choose the road, it can be a road trip. So you can come here one day, apply, then get out and go for your road trip back, so that you maintain your 90 days calendar year. That will help you when you're doing your exams and when you're doing your two exams, the oral and the written one, because it takes like a month, and then it takes 3 months again to get the results. So you have to really calculate your days. And luckily the Kenyans here are, hey, my God, they're so amazing. They let you know, like from day one, this is what you're going to face. So there's nothing that came really as a shock. It's just that the emotions, leaving home, leaving your family, leaving your friends, it's quite for me, it's destabilizing. But when you remember the challenges you faced in Kenya, you really don't want to get or give up. So you have to go. Once you set your goals, you have to go through that. I think those are the major challenges. Oh, one more, permits. Oh my God, here, if you're not a patient person, you can really give up on this. So you have to be really patient. You know, there's one thing about saying I can be patient, and I consider myself to be patient. But no, here you are taught to be patient, because even right now as we speak, I'm still in the process of getting my work permit. It doesn't come easy. You have to really show like where the proof of work, and they prefer locals to international pharmacists. So they have to advertise for like 2 weeks. So you remember your 90-day period. You have to be really smart about that. That's why I was really coming to Kenya, and you see me, I'm in Botswana, but you're seeing me in Kenya. That's why I was there in and out, so that I could manage my 90 days. And yeah, it's still a process, but I'm almost there. So yeah, this, I can say that. Back to you, Diana.
All right, thank you so much, Dr. Gladys. If there is one recurring theme, is that it is not for the faint-hearted, but the most amazing thing is seeing you guys here and the allowing us to see that it is actually possible despite the challenges. So yes, it's not for the faint-hearted, but it is very doable. Dr. Grace Mwarage is here with us, and I would like to give her a chance to say something and tell us about moving to the UK and practicing in the UK. Dr. Grace, kindly unmute and say hi. Okay, Dr. Grace, if you can hear me. Oh, okay. Uh-huh. All right. I'm sure once once she's in a position to speak, I will let her say something. But for now, we can move on to a highly anticipated question. Everyone is asking themselves, and everyone is probably wondering, how much do pharmacists earn in Australia, in the UK, and in Botswana? So we shall start with you, Dr. Sandra. How much do pharmacists earn in the UK? Then we shall move on to Dr. Karl, and finally Dr. Gladys.
Maybe, I don't know, you can unmute Dr. Grace. She thinks she's muted on, but I don't know if someone can unmute her.
Okay.
While you're doing that, maybe there's something I forgot to share about the UK process. So the process is currently being revised so that it's more friendly to overseas pharmacists. The process, I know we'll tackle that, but the process takes approximately 2 years from the time you start school to the time you get licensed to practice. But they want to reduce it to 1 year. So let me just read this excerpt from the GPHC, just a minute. So they sent us an update concerning the process and said the council has decided that we will develop a consultation proposing one route to registration for international qualified pharmacists, which would take 1 year instead of the current 2 years. This 1 year program will include both university study and in-process training. We expect to consult on this next year and emphasize that there won't be any changes to the OSPAP course until September 2026 at the earliest. So there's a high chance from the September 2026 intake that you will be doing the pre-registration training at the same time as studying. So it would, I don't know how it would work visa-wise. Most likely it will be a skilled worker visa. So it would be much more affordable. So meaning it's actually something to start looking at now before that time comes, so that now you're ready to apply, because when they make it easier, everyone will apply. So maybe it's something to think about. I don't know if we managed to unmute Dr. Grace. Or she says not yet.
Not yet, okay.
So maybe we can answer the question. Sorry, we can answer the question about the as you wait for that. I think she's really having a really big challenge with technology today. So the pharmacist pay in the UK is in grades. They're called bands. So when you're an intern, quote unquote, it's called foundation year trainee. When you're a trainee pharmacist, the pay varies. You are in band 5. So it goes from band 5 and it goes all the way to, just confirm, to band 8D. So when you're a trainee pharmacist, you are in band 5, and the salary there ranges depending on where the location is and whether you're in community pharmacy or hospital pharmacy. It ranges from £22,000 per year to £34 per year as a trainee pharmacist. Then once you get licensed to practice as a junior, you become a junior pharmacist, you proceed to band 6. So band 6 pay depends on the year, how many years you've been practicing. All the bands actually depend on how many years you've been practicing. So it ranges from £37,000 to £44,000 as a junior pharmacist. Then if you now become a specialist pharmacist, maybe you decide to do clinical pharmacy or any specialist course in pharmacy, the pay ranges from between 2 years and 5 years of plus of experience. The pay ranges from roughly £46,000 to £52,000 per year. So it keeps going up until the chief pharmacist. If you're a chief pharmacist, you can earn up to £100,000 per year. So I will allow Grace to continue that conversation. I see she's here. So maybe she can continue talking about the produce herself.
Okay. Dr. Grace, are you in a position to?
Yes, finally, it's been such a struggle. My apologies.
I'm sorry.
Yeah, but
Please
we're here
go ahead.
finally. Yes. Do you mind just repeating the question again, and then I can just take over?
Yes, so we are on the discussion. We are on the topic of how much do pharmacists earn in the UK. You could tell us about that briefly and also tell us about how long after the move it took you to start practicing.
Right. I think I had Sandra mention it a little bit. Yes, the figures are quite accurate, but just to bring it, closer back home, as a trainee, just an exact figure would be anything between 1,300 to 1,800 pounds a month as a trainee, but that tends to, go up after you have gotten your registration and certification as a pharmacist. As she did mention, it's banded. When you start out as a pharmacist, you'll start as a band 6, and the lowest you can earn would be about 38,700 pounds. Remember, for us as international people, you have to be sponsored. Your visa has to be sponsored, and the government stipulates your lowest salary for your employer to be able to sponsor you to work as a pharmacist. So currently that figure stands at 38,700 a year. You go up the bands. Now, depending on exactly where you work, it can take a year to move up each band or less, just depending on how involved you are, because going up the bands has to do a lot with just checking certain boxes where they go like, I feel this pharmacist is competent to do A, B, C, D, then you can move up. The figure tends to change. It was much lower when I started. It was at around 28,000 pounds a year. But then now it's gone up to 38. And so every year they just keep amending. It goes higher. Right, with that would be in the NHS, it's banded. But when it comes to the private sector, which is a lot of community pharmacy and another sector called GP practice, which is more of like primary care, it's a smaller hospital where they deal with less serious conditions or people who have chronic medical conditions where they need continuous follow-up. In that private sector, your pay can vary. It just depends on how well you're able to negotiate for yourself and the skills that you present to possess and how they'll be beneficial to the rest of the team. So it could honestly be anything. And then also depending on where you live, places like London pay better because the cost of living there is a bit more expensive. Farther from London, it can be lower, but then also it's offset because the cost of living is a bit less. So it is good pay. Yeah. Is there anything else, sorry, that I've missed out?
Not quite.
Yeah.
Perhaps we could now move to Australia. You could tell us, Dr. Karl, how much does a pharmacist roughly earn in Australia? And also, which state or province is the most conducive for practicing in Australia?
Yes, thank you, Diana. Thank you, Grace, and Sandra for the detailed highlight on the pays in the UK. Well, I'll pick from where Grace has left. I think these 5 countries, the US, Canada, UK, Australia, those 4 sort of share the structure of their healthcare. So in Australia as well, there is banding of pay. Well, starting with the entry-level pharmacist. So four things come into play: your level of practice, where you're practicing, and your I think the region you're practicing, as well as if you're an entry pharmacist or not. So I'll start with an entry pharmacist. Entry pharmacist will be someone who's just finished the internship. You'll start with an average pay of around 80 to 90 Australian dollars. That's thousands, I mean, 80 to 90,000 annual salary. Once you then maybe have 1 to 3 years of experience, you become a grade 1 pharmacist. Like grade 1 pharmacist, then you start from 100 to 120 per year. And then after another 2-3 years of practice, you can now be a grade 2 pharmacist. Your salary progressively increases up to when you're a senior pharmacist. All right. So the other categorization is whether you're in the corporate space. There are people who are maybe working for pharmaceuticals. The pay is much better compared to if you're in clinical practice, say in the hospital or in the community setup. And also if you're working for government or private. So for the pharmacists who are working for government establishments, there are better terms of pay, while the salary is not as high as in private, but there's something they call salary packaging, right? So salary packaging is something that allows you to have a better take home than what somebody will be taking home if they're being taxed a high amount. So a point in case is maybe you're in a private establishment. So you're just taxed at the normal range as any other citizen. But if in government, there's something they call salary packaging, right? They probably consider maybe your place, the place you're staying, or your family size, some points that they can help you to have a bigger take home. I don't know if that makes sense. So the highest that you can earn then will be around 200,000 per year. That is at the highest level of practice, probably 8 to 10 years of experience. Lastly, pay is also according to region. So it's a bit of the opposite from what I heard Grace and Sandra speak about. So in Australia, there's a push to move people out of the urban areas into regional areas. So there's a salary attraction. There's better pay in the countryside, right? So you'll find that yes, you're in the city, cost of living is high, but you're earning less than somebody who is in regional setups. The idea is to get more workforce, going into the regional areas just to open them up for development. And that is what is actually even bringing this idea of skilled workers from other countries. Once they come in, the visas that are mostly given out are visas restricting you to only work and live in the regional areas. Your visa doesn't allow you to work in an urban setup. So that's what I'm saying, that the idea is just to get more people into the regional areas so they can grow, and match with the cities. I hope that answers the question.
Yes, it does. And I believe it also answers the question of the most conducive area or place to work in Australia. For Dr. Gladys, how is you could perhaps briefly comment on how much pharmacists earn in Botswana, and also you could make a comment on the difference in practice between Kenya and Australia. Sorry, Kenya and Botswana, sorry.
Okay, so I can only speak about the interactions I've had. So the practice here is like a pasted Kenya. So whatever you practice in Kenya is what is practiced here. So even I'm getting to learn because the major space here for a foreigner is the community pharmacist, which for me, everyone who knows me know I'm better placed in a marketing setup, but I found myself in a community setup, so I have to market the drugs in the community setup. So yeah, so if you want to earn better, you have to work for the private sector, which the lowest you can go. I'm hearing Dr. Karl quoting 100,000 per year. I'm like, where's my math? Here, here I'll just convert because it's like one puller equals 10 bob in Kenya. So it's quick math. So the lowest you can earn as a starting pharmacist with very little experience, like me, you can earn up to 200K Kenyan shillings per month net. So take home that you take 200,000 per month, which is comfortable for an African setup. So here in Botswana, you'll earn around 20,000. That's the least. But your pay can go as high as I've had people earning 350,000 in a community setup, take home. That is all expenses out. So it depends on how you negotiate for yourself and also your experience and how fast you can learn the systems, which I believe as Kenyans, you can learn the systems haraka haraka. So maybe a better bargain would be if you move, like Australia, you move to the outskirts of the city. Remember, our population is so low. So the further you go away from the city, the more valuable you are and the more pay you get. Because as a starting pharmacist in a town like Kakamega, we call it here Ganzi, you can earn a take home of say 24, 25, 250,000 Kenya shillings as a newly registered pharmacist. So it really depends on your stamina if you want to work in the city or if you want to work in the countryside. And I've had a bit of experience of traveling around. Again, I'm a traveler. So I've gone to these remote areas and they're very nice. They're very cozy. And as pharmacists, you can really, like if you don't want so much distractions of the city and you want to chill, you can work there. Although the amenities are kidogo, like 2 million, kidogo, small hard, but yeah, you get everything in those, everything is devolved here. So you get each and every service, water, electricity, everything. So it's not like really local. It's just that you'll be far away from the city and the airport, maybe. But in terms of working right now, still, I've had an offer. I'm still waiting for my permit, so I'll be around kidogo 250,000 net home.
Okay.
Yeah.
All right. Thank you so much. Thank you so much for that very, very elaborate explanation. Next up, I would like to direct this question to Dr. Grace. Could you please describe the different career areas and the scope of practice for pharmacists in the UK, and if there are non-clinical career paths for pharmacists?
Right. I think I'll probably start with the last question you've asked, which is simpler. There are non-clinical paths, and the good news is that you don't need to be registered as a pharmacist. You don't need to go through that process. However, the non-clinical path here is going into the industry. The challenge, however, is that they tend to prefer their own because I don't know, someone else mentioned that they prefer locals. So if it's something that locals can do, they'll prefer to have them because sponsorship is also a responsibility most employers would rather avoid. So yes, they are there, but tough. You can try and come in as for a master's and then go into the graduate route visa, which is they allow you to stay after a master's for about 2 years. It's expensive paying for that visa, but it gives you time to, do other jobs, try to get your foot in. It's a route that some people I know have attempted. When it comes now to the scope of practice, I'm personally in clinical practice. You can, I think it's quite similar to what we have in Kenya. You can either work in the community, you can work in the GP practice, as I mentioned, you can work in hospital. Most communities are private, as I said previously. And when it comes to the scope of practice, it's very, very clearly defined by the law, and everyone tends to stick to what is stipulated their role entails. You do have technicians, you have pharmacy assistants, but for example, like in the hospital, no drug can go to a patient unless a pharmacist has approved it. Hata kama daktari ameandika, it still has to be signed off by a pharmacist as appropriate for a patient. In the community setting, yes, everyone graduates. They don't have a B Pharm, they have an M Pharm. Everyone graduates as a clinical pharmacist. So even in the community, there's a lot of that. There's a lot of services that they offer. The contraception, which I appreciate, is also being enrolled here. There's a lot of vaccinations that pharmacists that's their job. The other key thing is also being able to identify red flag symptoms. You have a patient who constantly comes in buying omeprazole. They've been having this, GERD or hyperacidity for a month or, for years, and then just being able to recognize that there could be an ongoing problem here and understanding the referral systems, because again, you have to be very careful, because if such a patient came to you, you sold the drug, they came to you again, you sold the drug again, and then say they had a GI bleed because, something was just not right and you failed to refer them, the inquiry will come back to you and you'll have to explain, why did you miss this? Why did you not pick this up as a red flag? So there is a lot of, you have to be very clinically oriented in the community pharmacy as well. What else can I add in terms of the scope of practice? Yes, so the key thing is, they say, keep learning, keep growing, but practice at the level of your competence. If you're not comfortable with something, don't do it. If anyone pushes you to do it and you're not happy, report them. But always stick to your competence, because you'll always have to justify why you did what you did. Yes.
All right. Thank you so much, Dr. Grace. The next question is for Dr. Karl. Are there areas in pharmacy practice in Australia that we in Kenya or Africa at large can pick and use to build our practice, considering that our audience does not only comprise of Kenyans, but also people from other parts of Africa? So what are some of the areas in pharmacy practice that we can adopt in Africa and use to build our practice?
Thank you, Diana. I'll give a disclaimer that in the larger Africa, I've only been to Kenya, so I wouldn't speak for other countries in Africa. But I hope the practice really mirrors what is in Kenya. Well, Kenya is really among the top countries in the continent. Grace pointed out a very important note, that practicing within your competence, because things do go wrong, and when they go wrong, there is always audits that are done to really determine what went wrong, and then just to not to be malicious, but to find a way of preventing from it occurring again. So you find that most of the time, yes, the first point of contact for a patient is a community pharmacy. So you need to really have your antennas high, pick out things that you can manage, and be sure that that is the correct diagnosis that you could come up with, give the right thing, and watch out for repeat patients. If someone is consistently coming for the same thing, you shouldn't give them the same thing more than twice, right? You just need to refer. I mean, you're better off referring a patient than giving them anything. I know at home here it's about making that sell, but it's the other way around on the other side. So you're better off actually not giving the person anything than sending them to a GP, because everyone is actually tagged to a GP. So just tell them, go see your GP for that. I think I can't do much here. Or offer some painkiller. You can never go wrong with the Panadol. Just say try this. Once you find time, see your GP. But that does not say that you do mediocre job in the pharmacy. You have to, do something. This is just a caveat that do not do any harm to the patient, right? And when you receive prescriptions, maybe from private clinics or the hospital, if there are any changes that are being done, you have to put notes in the system. Something that I should have mentioned earlier is that there's a universal sort of system that the whole country uses, right? So if a pharmacist is in Kajiado, let me use that example, the system they're using in Kajiado is the same system that a pharmacist in Mombasa is using, all right? So, and that system is also used by the government to see what drugs the patients are being billed. So if there's anything that you're doing to the patient, you need to put down notes that patient X came to me on this date. This is what I gave them because this is what I thought they were suffering from. And then I referred them in case they felt that they were not feeling better from the medicaments provided to their GP. All right. So notes taking is very important because that record will save you in case of an audit. If something goes wrong for that patient, they go to some place, they collapse. The first thing will be, what has the patient taken? Or they'll check, okay, they came to your pharmacy. Then what did you give them? I gave them this because this is what they told me, right? Yeah. So that is one, record keeping. And then number two, healthcare is funded by the government. Yeah. So anyone falling sick, healthcare is the government's bill. So the financing model is not like what we have here, where you get your script from your doctor, you come to a pharmacy, then you start negotiating for discounts. Nipunguzie maybe ikwe 500 badala 300. The government has set the price that Panadol will be sold at $5, right? You go to any pharmacy, that is the amount that will be charged because it is the government again paying for that same money. So all you need to do is present your script to a pharmacy, they will bill it, and then off you go with your medication. But that comes with a caveat. It's not like all medication is paid for. There are those that will have a surcharge. A surcharge is to mean maybe a drug is costing $20. But the government has said we will only pay $15 for that particular drug. So you as the patient will then have to pay for that $5, right? But all in all, medication is funded by the government. So that is number two. Number three, I think that pharmacists are really involved in the care of patients. And also the space of practice is wider. You find that besides our traditional community pharmacy, hospital pharmacy, and industry, there are many areas that you can work in. For example, the system that I mentioned, the people who maintain the back end, they're pharmacists, right? There's also what is called aged care. So the aged care setups, for those of you who've been able to go to, other countries, when citizens generally age out, it's the government's responsibility to take care of them. So government has aged care setups where those who are probably 60 and above are sent. And then there is a huge band of healthcare professionals who are stationed in each of those aged care facilities to take care of them. So pharmacists are among them, all right? So that is the other sector that you can actually practice in, which I don't think is really hard. You just need to be ensuring that you're going through the medication that that particular person is taking, ensuring that they're taking them at the right time. And if there are any interactions, you alert their GP for any changes to be done. And then lastly, there's something we call medication check. As a pharmacist, you can liaise with local GPs. You tell them, hey, look here, maybe you have X number of patients. When you realize that there are patients who have maybe more than 10 medication on their list, refer them to me so I can do a medication review to see if we can reduce that burden for them. So it's a two-way practice. A GP can refer a patient to a pharmacist who he knows does medication reviews, or you can request the GP to give you a referral to do those medication checks. And also at the pharmacy level, you're allowed to do, if you find that a patient has come in and their script is having more than maybe 7 medication, the government allows you to do a medication check. They will pay you for it as a separate thing, because that goes to add value to the patient's care. All right. In a nutshell, those are some of the areas I feel that we could borrow, but I think because of the financing aspects, it takes a lot of commitment, a lot of budgeting. It might take time, but if we were to borrow them home, then there will be a good thing for the practice. Thank you, Dana.
Thank you so much, Dr. Karl. A lot of takeaways from your response there, and I hope that one day we could get there, especially the financing bit. And thank you for highlighting the part about documentation. You cannot emphasize enough the importance of record keeping and documentation. So thank you so much for that elaborate response. It is worth noting that we shall have a separate session specifically tailored for applications and relocating to the UK. So in case all your questions are not answered in today's session, please be on the lookout for that. I think we shall be covering the OSPAP in details. So please be on the lookout for that. Next, Dr. Sandra, we would like to know what motivated you to pursue this path.
One of the motivations is money. I feel it's true. So just you feel like you can be working in a place for so long. You're seeing the quantity of work you do is not commensurate to your pay. So just looking for greater, better opportunities. The other motivation for me is work fulfillment. I feel like the pharmacy practice in Kenya, you don't get to practice what you studied in school. You literally, I feel like you can just go into a pharmacy and dispense medication, but the aspect of medicine's reconciliation, consulting with the doctors, very few people get a chance to actually practice that. It's good in the private sector, but in most public sectors, pharmacists basically forget the knowledge they learned in school, whereas you're supposed to actually be getting better as you practice, because you're supposed to be challenged to study more, get to know more. And so just getting to wanting to experience a different kind of practice in a place where pharmacists are, I'm not saying Kenyan pharmacists are not relevant, but there's space for where the position of a pharmacist is really recognized. And like Grace said, like a drug can't go to a patient unless a pharmacist has approved it. That kind of visibility and getting to practice what you learned. So basically, financial motivation and work fulfillment. I think work fulfillment is really, really vital. Yeah.
All right. Thank you so much, Dr. Sandra, for being very candid. Next up, I see our time is far much spent. We literally just have 4 minutes remaining, so we really need to wrap up. Dr. Gladys, kindly, very briefly, tell us if you were to choose between Kenya and Botswana, which option would you go for?
Let me first say Grace was a classmate of mine at one point in time. Hi, Grace. And Karl was one of my mentors in Kenyatta University. Sandra, it's a pleasure to meet you. So, choosing Kenya and Botswana, honestly, by God, I'd choose, in terms of country, I'd choose Kenya because I love Kenya. In terms of practice, I'd choose Botswana over a million times. One is because whatever Karl has said is also practiced here. The government is the one financing most of the patient, not all, but most of them. Everything in Australia is also being done here in Botswana. And the pharmacy has their own place. Like it's from, again, I'm saying this from a viewer's perspective. I've not started practicing and I cannot say anything apart from what I'm viewing as I volunteer here and I'm in training here and there. But basically, I choose Botswana because, hey, of the money too. Meskia, it's the internship money, gross, it's net here. So yeah, I choose Botswana again. But why I'd encourage someone to come to Botswana is the visa interview process in Kenya for if you're planning to go Western. Like I was applying for my master's in the US, it's easier to get a visa appointment here. So it can be your, maybe your, what is it called? It can be your holding country for like 2 years. You practice and see what other African nations are doing as you wait for your transit to wherever you go. I have not made that decision yet. So I'm still trying to see whether it's my destination or is it like a transitioning country. So Botswana, you better be good to me. So that's all I can say.
Thank you so much, Dr. Gladys. As we wrap up, Dr. Grace, is there anything you would have done differently in this journey?
Wow. Is there anything I would have done differently? The journey to practice elsewhere, yeah?
Yes. The journey of and the whole process of moving to the UK.
No, I think the only thing I'd have done different maybe is start it sooner. Yeah, that would be the only thing I'd do different because, like Sandra said, lots of job satisfaction and the financial compensation isn't too bad as well. So yeah, probably start it sooner. As soon as you finish your internship, you feel like, you want to get started, yeah, reach out. That's it.
All right, thank you so much. There are a few questions in the Q&A section that I would like us to quickly go over. Kindly, guys, please bear with us. Give us a few more minutes to answer some of these burning questions. And if in case your question will not be addressed in this forum, kindly feel free to connect with our panelists via LinkedIn, and I'm sure they'd be happy to answer your questions. So someone is asking, what is the advice for people who have families and are willing to relocate in this case, mostly with children below 10 years? So what is the situation like for people who want to relocate with their families? Anyone?
I think I can take that one first. As a person without kids, the money can be adequate. However, it can be quite challenging moving with kids, especially the UK landscape at the moment is quite volatile. I'm sure most of you have seen that online, and the government is trying to make a lot of changes. Previously, you could come to the UK and apply for a dependence visa where you could bring over your partner, your kids very simply once you have a job. And again, because you need to be sponsored, you would have a salary threshold that you need to attain for you to be able to also bring your family over. So that was amended last year, and at the moment it's still a bit murky. So we just be on the lookout, see how things go. But at the moment, I don't think it's quite a ripe environment to move with kids.
All right, thank you so much, Dr. Grace. Dr. Karl, is it different or is it similar? Are the laws stricter or more relaxed in Australia? in terms of relocating with your dependents?
The answer will be very straightforward. It's costly, one, to move, because for every person that you are putting on your visa, you have to pay a separate fee for them. So if it is a skilled visa, I think right now is around 5,000. So for every head you're adding, that's another 5,000. Maybe they might discount for kids below 10 years, but anything above 10, it will be another 5,000. So if I had your question was for a family of 4, right? So that you're looking at 20,000 plus dollars, and you've not put in maybe bills when you get there. Well, the bigger the family, the bigger the bills. And anytime you speak to someone outside the country, the biggest challenge is what? The bills, right? So unless you are very well endowed financially, I don't even know why you're living if you're very well endowed in the first place. So for those who are living, I'm sure you need to really save as much as you can. So it is costly, but if you have to, then prepare yourself to really spend or work hard to make enough to pay for those children. If they're younger than 5, you have to put them in daycare. Daycare is costly. I'll just give you an example. Per day, you have to pay around $200 one day.
Oh, okay. Dr. Karl, were you done?
This is think I'm done.
Oh, okay. I was just making sure. So the truth is, it's going to be expensive if you'd like to make that move to Australia. Just a reminder, the links to the URLs to the panelists' profiles on LinkedIn have been posted on the chat section, so feel free to connect with them in case you have further inquiries. Very quickly, the next question is still meant for you, Dr. Karl. Someone is asking which state you are in and whether you did CAPS while in Kenya, and if so, how did you manage to secure an internship? Did you do so while in Kenya or while in Australia, and how long did that take?
How many questions are those?
Quite a number. Perhaps you could start with which state you're in and whether you did your CAPS in Kenya.
Okay, yeah, I am in a state called Victoria. So Victoria is among the states that most immigrants move to. And then I did my CAPS in Kenya. I don't know if there's an option of doing it overseas. Yes, you can do it if you came as a master's student. I know of students who've come as master's student, then they opted to do the CAPS so they can then be registered as pharmacists. What was the other question?
The other question was, how did you manage to secure an internship?
Right. So there are recruitment agencies. As I said, if you want knowledge, you'll get it. I didn't have anyone to ask, but just digging information online. So I got like 3 recruitment agencies. I did interviews with all of them. I got offers from all of them. Then I chose one. That's where I'm working.
All right, thank you so much. The next question is, I will direct the next question towards Dr. Sandra. Is it cheaper or easier to apply for all this as a master's student?
From my point of view, it's better to go as, if you want to practice as a pharmacist, just apply for the OSPAP course, the Overseas Pharmacist Assessment Program. because you will spend money on your master's program and you'll still not be able to practice as a pharmacist. So, and if you go on, let's say, a government scholarship, like Chevening Scholarship or MasterCard, you'll still need to come back to Kenya. So I would advise you do the OSPAP course, and then after you get licensed, you can do your master's after that. I think Grace can agree with me on that.
Yeah,
All right.
there's no shortcut. There's no shortcut to practicing as a pharmacist. It has to be through OSPAP.
Okay. Thank you. Thank you so much, Dr. Sandra and Dr. Grace. The next question is directed towards Dr. Gladys. Dr. Gladys, you mentioned that it can be very expensive to relocate financially, and someone is wondering what's the approximate cost involved in transitioning from Kenya to Botswana?
Sorry, I have children around, so the cost. So it depends on how you look at it, because you'll need accommodation, and accommodation here it's not as cheap as Kenya. So I'm assuming like the best thing is that you don't pay for the test. So your only expenses will be the airfare, if you're using airfare, and maybe the bus ticket to Botswana. I don't know about the bus. So maybe the airfares can range from, just give me a minute.
That's totally fine. The next question will be directed to, just a minute. Or someone is wondering whether the process and experience we have talked about and discussed today can be applied for a pharmacist from another African country like Ethiopia. Could you be knowing if the same process applies to other African countries? Dr. Grace?
Yeah, when it comes to the OSPAP, so it's just banded into three: either you're UK citizen, whether you are from the EU region, and then the rest of the world. So the process is the same if you're in Ethiopia as if you are from Kenya. So yes, it would be the exact same.
All right, thank you so much. Somebody is also asking if hospital practice is the main field, both in UK and Australia. Dr. Sandra could answer that briefly, and Dr. Karl could make a comment after Dr. Sandra's response.
Let me direct that one to Dr. Grace.
All right, Dr. Grace.
Sorry, could you just say that again, please?
Somebody is asking whether hospital practice is the main field, both in the UK and Australia. So I was hoping you would make a comment. You could answer that, and then Dr. Karl could make a comment on the same concerning practice in Australia.
Majorly, I would say yes with regard to if you're coming from a foreign country, because the UK have a occupation shortage list, and what they need is people to serve in the NHS. So that's where you'll get most of your jobs. So yes, I would say it is the main, but there are very many other areas. Once you are qualified, going to hospital practice, pivot to wherever else your interests are. So it's just easier to start from there.
All right. Dr. Karl, would you like to make a comment on the same?
Yes, thanks, Dana. So I think it's pretty much the same. As I said earlier, US, Canada, UK, Australia, they sort of share the same stratification of the healthcare system. So what I see here is that largely most of the numbers are in the community setup, and then the other percentage will be in the hospital, and then the others maybe just decimal numbers being spread across the other areas that are highlighted earlier. I think the reason behind that is part of the law requires that any community pharmacy has to be run by a pharmacist. So you find that most of the numbers 10 will be found in the community setup, right? And then followed down with the hospital, with the other now cadres, industry, corporate, IT, all those other areas, just taking the few other percentages. Thank you.
All right. Thank you, Dr. Karl. Dr. Gladys, I'm sorry we cut you short when you were in your response, so kindly.
Thank you also. So so your biggest financial, I don't want to call it challenge, but where your investment will be, maybe it's your mode of transport. So that might cost you maybe roughly. I'm thinking if you're going to go and come back so that you do your exam and up to the registration, if you work it out, maybe 200K, because the flights, especially Ethiopian, can do 40 return on a good low low season, yeah, off peak. Yeah, you can do Mombasa to Botswana, so that's way cheaper. So you can maybe invest maybe around 200, 300. That is your major investment in terms of flight and accommodation, because here it's quite expensive in the city, and we all do exams in the city. So yeah, that would be your major budget. But aside from that, now when you are registered and now you have to wait for your jobs are here, you have to be in the clinical space. I searched for NGO and clinical. They prefer local. Like if a local applies, you're going to be out. So as like from what I'm getting, when you move from Kenya, just know your role will be clinical, then you can go to wherever else after some time. So yeah, I think that's all I can say. Yes, thank you.
All right, thank you, Dr. Gladys. So I will be asking the last question, which will wrap up this Q&A section. And in case your question has not been attended to, feel free to connect with the panelists on LinkedIn, and I'm sure they'd be happy to answer your question. So with me here, I have a very interesting question. I will ask Dr. Karl to answer, and someone else, either Dr. Grace, Sandra, or Dr. Gladys, can have a go. Someone here is asking, I know moving away from Kenya can be so lonely. So my question is, are the locals over there welcoming? Can one find love? Yes.
I'm interested to know why you chose me first.
Well,
but it's
you're
fine.
the only male person in the panel, sorry.
All right. So they're asking if it can be lonely to be in a foreign. Well, to be forthright, something has to give. When you leave your home, you're cutting your social ties, the community structure that you have. You're simply cutting all that. Yeah. So to some extent, yes, loneliness does set in because you're thousands of miles away from all these social setups that were giving you warmth, right? But as you get to know people, you form new relationships. If you're a Christian, getting to get a local church that you can go to. Slowly, then you get to bond with people, right? And gradually you fit in. So I think, yes, the early years can tend to be lonely, but as you go along, you tend to find a community establishment that you can gel into, and that can also help in your social life. Uh, I hope that that answers one part of the question. The other part of the question, which I think he or she is trying to ask is uh, if you can get, someone or something. So yes, it's possible. Well, depending on your like, right? There are other immigrants in any other country. You can find, if you have similar likes with someone, it's possible. Um, but if you have someone, better to move with them. That would be the advice.
All right, thank you. Perhaps we would like to hear from a female panelist. Is it Can One Find Love? Are the locals welcoming? Okay, Gladys, you seem like you have something to say for guys in
What I'd
Botswana.
like to say, please comment on the UK, both of you. Maybe it's easier there. Oh, but here it's Africa. It's just like Kenya. So I don't think there's anything different I'm experiencing here. But there's a lot of love you can get here. Depends on which one you choose. But I want to hear from the UK, especially Grace and Sandra. Is there love?
The UK is cold. Please carry your own love. And yes, run clubs are the new dating sites. So join a run club, go to the gym, join an online dating site. Yeah, they can be warm, but also everyone really minds their business. So yeah, love is in the air, the cloud.
Okay.
Just one more thing.
Dr. Sandra, no comments?
Even I wanted to ask Dr. Sandra to comment also.
Gladys, I see you. So um, I think just carry that self-love. I don't know what kind of love people are asking about. If it's love of family and friends, make friends. If it's the other kind of love, I don't know, just carry it where you're going. It's, yeah, but yeah, I have no further comment. Yeah.
All right, thank you. That was a nice icebreaker. And as we wrap up, I'd like to ask you guys if it is worth it. This is the parting shot. Is it worth it? 30 seconds each, and then we can wrap up.
Let's start from Africa.
Okay.
I think the move is worth it because we've all seen how the practice in Kenya is going, and you can always project further, like how are you feeling satisfied at work? Do you see yourself grow, or are there more opportunities you can explore before, like me going back to Kenya because that's my love. So I feel like it's worth it if you want to grow, but carry your self-love as I've had. Also love God. If you're a Christian, the better because you'll need a lot of faith for the challenges. And also, please be emotionally prepared because it's very emotional. Also, reach out to other pharmacists. Here in Botswana, the pharmacists are very nice, the locals and also the ones from Kenya. If I had not met the pharmacist here, I don't think I would have been in Botswana. I'd be probably struggling in Kenya. But I thank God for Dr. Mukabi and Dr. Mburu from here in Botswana. And I know they will get a pick of this this meeting. And yeah, please reach out to pharmacists. They can also host you if you don't have a place. So always reach out. Thank you.
All right. Thank you, Dr. Gladys. Dr. Sandra, is it worth it?
It is definitely worth it. It is tedious and emotionally draining. I think no one really tells you how emotionally draining it is. As Gladys mentioned, whichever place you're going, it's very draining. So, but it's totally worth it when you finally get to that place where, like for me, it's been like almost 1.5 year process, the applying for the OSPAP course, and finally getting to the place where you're now going to do the course and doing your pre-registration training, and seeing the end of the tunnel, the money you're going to be making, and the job satisfaction. It's definitely worth it.
All right. Thank you so much, Dr. Sandra. Dr. Grace, is it worth it?
Yeah, I'd say definitely, it's definitely worth it. I think as Africans, we are born quite resilient, and Kenyans are not left far behind, very, very resilient. So you'll need that, carry it with you. And I forgot to mention, for anyone who's considering to come to the UK, as pharmacists in the UK, there's a very big community. We've decided to come together and form a group specifically for helping anyone who would like to transition and offering support to the ones who are, on the way coming, and, just being, there's a mentorship program we're also starting, things like that. So we will hold your hand, we'll help you settle in. That's it.
All right. Thank you, Dr. Grace. As we wrap up, Dr. Karl, is it worth it?
It's a good question. I'm just sitting in listening to Gladys saying they have other pharmacists who she came across, Grace saying they have a network that they're setting up, there are other pharmacists there. I can say that when I was coming, it was just, there was no one to really look up to it. And even up to this point, there's only one other Kenyan pharmacist that I know, right, who also just recently came. Yeah? But it's a good thing, yes, to find a community that can hold your hand and help you start up, if you can find one. I'll agree with my fellow panelists that it is a worthwhile endeavor, determining on your goal in life, okay, and at what point you are before moving. I have colleagues who are already GMs of the general managers of some big suppliers, or some big corporates already in the country. So if somebody like that asks me, is it worth it to move? I'll tell them, no, just you're already on a good path in life, so just go on with that corporate ladder. But somebody else who's just starting off in their career, yes, it is a worthwhile endeavor. If you can manage, go for it. It is satisfying both financially and also practice. You tend to see that the space to practice as a pharmacist at home is shrinking every other day. So it will be fulfilling financially as well as career-wise. As I said earlier, something always has to give. So what is giving here? Your social network, you have to give that to receive these other ones. You can't have your cake and eat it at the same time. Thank you.
All right. Thank you very much, Dr. Karl, for that wonderful parting shot. I'd like to give the chance to just one person who has had their hand up for a very long time. David, I'm guessing you have a burning question. Kindly unmute and ask. David? David, if you're in a position to unmute.
Hello? Hello?
Yes. Yes.
Can you hear me? Okay, so
yes,
it's not a question. It's to say thank you, guys. The whole lot that is in the panel, I realized one thing: you're all very young, which is awesome. Some of us transitioned 20 years ago. Others to these groups to help the young people, and honestly, we've helped so many. We've been able to advise a ton of them. I lived in Botswana, so the Botswana crew, how are you? I transitioned from Botswana to America, so I'm here, and I can tell you, the journey challenging, yes, but fulfilling. I keep telling everybody, we learn so much in school. Our school teaches us a lot, but we don't use it when we get to the world. So what was most fulfilling for me was the knowledge. The fact that what I had, I could use it. I met the author of Gaiton. I met the author of certain books. Reading. It was like a life-changing moment for me. I went to the University of Baltimore. I went to Johns Hopkins, which are the top schools again in this country. So when you're here, you start to realize that it's not just all about money. And you will probably never worry about money. Money will just come as you work and you continue working. The opportunities are endless.
All right. Thank you so much, David. Thank you so much for that wonderful comment. Thank you for, yes, thank you for your encouragement. And on that note, I would like to end this meeting by thanking our wonderful panelists for taking their time to join us this evening and to share their knowledge and to share the whole experience of relocating from Kenya. It has surely not been easy, but seeing you is such an encouragement to everyone out there who would like to relocate to another country. This is your sign. Go for it. And yes, thank you so much, Dr. Sandra. Thank you so much, Dr. Gladys, Dr. Karl, and Dr. Grace. It was really nice having you, and it's been a pleasure. Thank you for staying this long, and apologies.
Dana,
Yes.
maybe if
Yes.
we could get Dennis's full name, David. Sorry, the
Oh
one
yes,
who just
yes. Oh yeah.
Okay.
Yeah.
Am I still on the mic?
Yeah.
Yes,
You're
yes,
still on?
you still are.
David Kariuki Gashie. I was 1995 class graduate, University of Nairobi.
So that's David Kariuki Gashie.
Gashi.
Gashie,
Ga?
yeah. Gashie.
Okay, thank you so much.
All right.
All right.
All right. Thank you so much, Dr. David. Yes, and thank you so much to our panelists and everyone who has been able to stay on for this long. We appreciate you. Thank you so much, and have a lovely night.
Lovely evening.
Feel free to leave.
All the best to everyone.
Good
Thank
night.
you.
Thank you.